A very good morning to you on this 27th day of June. Welcome to the broadcast. This is News Center. From wherever you're tuning in from, we bring you the latest, including that developing news from yesterday night where Shalom Hospital in Athi River, Machakos County, was temporarily shut down due to an outbreak of COVID-19 infections. We bring you that and the latest. Do stay with us. We begin on that note where Shalom Hospital in Machakos was on Friday night closed to new patients and turned into a quarantine facility following reported cases of COVID-19. This follows the death of an unspecified number of patients at the hospital as a result of coronavirus. Machakos Governor Dr. Alfred Mutua said the decision to shut the facility was reached after consulting with Kenya Medical Practitioners and Dentist Council and the Director General of Health. In regards to this, let's speak to Dr. Mercy Korir on the decision to close down the hospital and what that portends. Dr. Mercy Korir, many thanks for your time. This is definitely not good news, even as we continue fighting COVID-19. But is closing Shalom Hospital the best response to the outbreak at the hospital, assuming that this isn't the first case in a healthcare institution?
Well, you've got it spot on, Jesse, because many hospitals, including even the Kenyatta National Hospital, where at the beginning of the COVID-19 response, we had a child who died and his status was only known posthumously, that is after the child had died. And the hospital was not closed. What happened was certain measures were put in place to make sure that patients are safeguarded, the patients who still need services in that healthcare facility. And it is not just Kenyatta National Hospital. We have the major private hospitals have also had cases, some even identified way after the patient has died, some later on after the patients have even interacted with the healthcare personnel or they've been in the general ward. So from the look of things, and unfortunately here, the information is still scanty because I've been trying to get hold of the people that you've talked of that reached the decision to close Shalom, and I haven't been able to get through to them. But with the information that is there, I would think that maybe closing Shalom is not such a good decision at the moment because one, we are trying to contain the virus. And at the moment, with high local transmission rates that we are seeing going by the numbers that are announced every day by the Ministry of Health, you would want people to come out as much as possible to say, you know, I think I have come in contact with somebody who has COVID, or I think I may have these symptoms. And the best place for people to do this would be a healthcare facility. That's one, for people with symptoms. Two, people are going to healthcare facilities for other services. Somebody may have a broken leg, they need it fixed, they need to go to a hospital. Somebody needs to deliver, and delivery does not wait for COVID, they need to go to hospital. So if you close a facility because they have identified COVID-19 patients or patients have died there because of COVID-19, what are you trying to say about the living patients who still need healthcare services, who still need to continue with their lives? The best thing here probably would have been to give a proper forensic audit about what happened. One, does the hospital have these safety measures, these containment measures and protocols put in place to make sure that they've safeguarded the patients who still need to come to the hospital for other healthcare services? If not, then the hospital is at fault. If they are there and they were breached for one reason or the other, then the hospital is at fault because of that, and that is what should be addressed. Two, let's probably look at their containment measures now after this. Are staff going on quarantine? Are staff going for isolation? What are they doing to clean and sanitize that hospital and decontaminate it, like we've seen with the other healthcare service providers that have had cases of COVID-19, and allow the hospital to operate. Remember, this hospital is serving a certain catchment area. They're serving certain population who still need their services, who still need to go on with their regular elective surgeries, emergency surgeries that they would have otherwise not found elsewhere. So maybe closing the hospital is not a very good decision at the moment. But as I said, we still need more information, a probably a proper forensic audit to know what has happened, because otherwise, without that, then it would appear that the county government of Machakos and the health officials that are there are applying double standards on this hospital, yet not following what the precedence of other hospitals has been, Jesse.
And just to rebuff on what you said, we've recorded a drop in hospital visits in terms of hospital births, in terms of vaccination visits as well. And it's a worrying trend. So it begs the question, what are the consequences exactly of shutting down the hospital going forward?
So we had data, we'd seen data as a standard group from the Ministry of Health on the first quarter, where, for example, the number of stillbirths had gone up. So here stillbirths mean that these are women who have carried their pregnancies to term, but on the point where they were supposed to deliver, one, either they did not get access to hospital, or two, they went into hospital too late after they have labored for some time. So they delivered otherwise healthy babies who died just before birth. And the consequences here mean that these are women who would have otherwise gone home with their babies, but they're going home without babies. That's one. Two, we've had mothers that have died because they've been unable to access healthcare services. Because of the whole stigmatization of healthcare facilities, mothers are afraid to go to hospital to deliver, and they have died. These are families whose children have to grow up with mothers. The consequences are dire. We have vaccination and the rates of immunization going down. This means that, for example, if children are supposed to get their 9-month measles jab, they've missed it. What does this mean? We are likely to even get a measles outbreak up ahead because we are not continuing, we're not encouraging a continuation of other healthcare services as much as possible, because we are also afraid of COVID-19, such that people are now afraid of going to hospital for non-life-threatening things. Okay, non-life-threatening now, but in future, they may be threatening. Or they are afraid to go to seek healthcare services now, and they may lose their lives because they are afraid of getting COVID in the hospital. So what we should do, actually, what the governments need to do, the county governments and the national governments need to do, is to assure people that in the hospital, it is a safe environment, because they have put in 1, 2, 3 things to minimize transmission of COVID-19, because as it is now, you cannot stop it. But what you can do is to minimize and contain it as much as possible.
Even as assurance, Dr. Masikori, even as assurance is very important. What exactly needs to be done at the healthcare facilities? Because at the end of the day, we all need this very important service. What exactly needs to be done to ensure that the spread is actually contained?
Just the basic hygiene measures that we've seen being put across board, even in corporate institutions, where people need to wash their hands when they come into a hospital facility. They need temperature screening, and in addition, in hospital, they need to take a history of whether they have traveled out of Nairobi, for those who are able to travel out of the big cities or the cities that are under lockdown, or whether they have come into contact with somebody who has either been diagnosed of COVID or who is in quarantine. That is critical and important for a hospital facility. Then the hospitals need to have to design a way of patients flow, such that those who are high risk are directed in a certain particular place so that they don't interact with those people who are low risk, and so that you allow people to continue getting their healthcare services. 3 is that hospitals need to do regular cleaning and sanitizations, and hospitals here use bleach, and to do regular cleaning, decontamination, fumigation of all their workspaces, because here we know, just apart from COVID, there are other bugs, there are other bacteria, viruses that you can get in the hospital, so they need to do that regularly. So if all of these things have been put in place by the hospitals, then we will minimize. 2 is to know how to respond. Should one of their staff contract the virus, what is the next step? For isolation, for quarantine, if a patient is diagnosed to have COVID-19, what is the next step for isolation and contact tracing and quarantine for all of those people? Then the other one, and we've seen the private hospitals do this, is that anyone coming into the hospital for admission as inpatient, they get a mandatory COVID-19 test. So probably it's time to roll that out to all healthcare facilities, such that either it's covered by government or there is a cost-sharing measure, such that anyone who's getting admitted into the hospital, they know their status. And I've seen several hospitals put this in place so that they're able to pick out, identify, and do the necessary precautions for these patients. Remember, if you're going there because of disease A, then people are afraid to attend to you because they're afraid of COVID. Then what took you there may actually be the one that kills you and not the COVID-19. So we need to be very cognizant of not disrupting the other healthcare services because we are afraid so much of COVID-19.
Well, it's definitely an intricate balance. We'll continue following this up. Dr. Mercy Korir, our medical health correspondent right there, bringing us up to speed with the latest in regards to Shalom Hospital in Athi River, Machakos County, which has now been shut down and is acting as a quarantine.